about raising our children in a cannabis world. And we are talking about the joys and the pains of that. And so today we have three trailblazers, really, three trailblazers, and from around the country, and that bring actually a world of experience to the stage. And so what I'm going to do first is just ask, where are you in the world, and tell us a little bit about yourself. And Miko, if you'd start, go ahead.
Sure. My name is Miko Hester Perez. I am one of the first parents who went public on Good Morning America in 2009. Our family has been coined as the family that opened the door to using cannabis to treat autism symptoms. And because of that ride, I've been on this roller coaster for 11 years. I am now a global healthcare advocate, working here in several other countries. And I continue to stay in California. And I now am doing private consulting as well as a healthcare ambassador for one of the first cannabis analytics labs in the world, Canasafe.
Oh, wow. Thank you. Thank you. Sebastien, my good friend, where in the world are you today? And tell us a little bit about yourself.
Sure. Well, thank you, Michelle. My name is Sebastien Cott, and I am today in Atlanta. I'm all over the place usually, but today I am home in Atlanta. And I have a little boy named Jagger. He has a mitochondrial disease. And Jagger, life expectancy with his specific disease was about 4. They told us we'll be very, very lucky if he sees his 4th birthday. So we had to do something, and we started looking into cannabis. And long story short, we even had to move to Colorado right before his 4th birthday to have access, because in Georgia, we still, as of today, don't have any access. But last week, Jagger turned 10. So he definitely made it way past his life expectancy, and cannabis has been just great for him. And, we really thank cannabis, and we really know that cannabis is one of the main reasons, if not the main reason, why he's still alive today. So because of that, I've been advocating all over the world. I am from France, so I've been speaking at conferences in France, in Mexico, in Jamaica, many places with you, Michelle. And I'm just trying to share Jagger's story and tell people that, cannabis is not, we got to look past the stigma, and cannabis is not all bad. And cannabis can be very helpful and can actually save people's life. So that's what I try to do.
Thank you for that, and thank you for what you do. Osiris, where in the world have we reached you today, and what in the world are you doing in cannabis?
Well, I am currently in New York City, Harlem to be exact. My wife and I, Nina Simmons, we have a 7-year-old boy named Aiden. He's the beginning of our journey. In fact, we host a podcast called Love and Cannabis that discusses our journey. Started back in 2015 when he was diagnosed with generalized epilepsy. And so we jumped on basically CBD oil a month after his diagnosis. So we didn't really wait that long. He was one of the first children in New York to have a medical marijuana card. Just when because the program had just launched in 2014. So he was one of the first few to have it. And we've been basically going to Albany and upstate New York, our state capital, promoting cannabis, promoting more dispensaries and more access and education about it. And now we also have a bill in New York State called S8191, Todd Shin's bill, which requires schools and educational institutions to provide access to the children's medicine if they are under the medical marijuana program. Because that was one of the issues we were facing, was that we had to decide between my wife and I who was going to basically relieve work and provide the medicine.
Yeah.
But yet they can provide, other medicines, but we couldn't provide the one that he really needed. And that was really had no side effects that we had to worry about. So that was our struggle. We worked with some local politicians, and we've also have spoken in certain events about this. So we really have reached out to a number of people across the country, and any support that we've been able to provide, just coach them through it, especially when you're dealing with education, medical, all these other things that you deal with, institutions that you got to constantly fight.
And I guess I'll say a little bit about myself. Thank you, Osiris, so much for that. I'm Michelle Dumais. I am in the desert of Arizona. So We like to say it's hot here, like a blowtorch. It's kind of cool today. It's only, I think it's going to be 102 today, so it's cool. My daughter was ill, life expectancy of 2 months to 2 weeks. We came to the cannabis party about, I think about 5 years ago now. And even though she had this life expectancy that was so small, 2 months to 2 weeks to 2 months, quickly we realized that she was going to be around for a while. And she actually had one small seizure in the hospital and then didn't have another seizure for maybe 7 years later. And at that point, we began to get on the medical scripting roller coaster where child has seizure, doctor does meds. Child continues to have seizure, doctor does more meds. Child has seizure, doctor says more med, another med. So at one point we were up to, I think when I counted a printout, it had 33 meds. And I believe a fourth of them were just for seizures. And I said, there's no quality of life here because she was sleeping 18 hours a day. When she was a day old, they had to remove a little bit more than half of her brain. So we had a very medically fragile child, as Sibo alluded to with Jagger, very medically fragile. So we got on this cannabis train and said, you know what, we want better for her. We want a better quality of life. We want a gentler, scriptive life. And we decided to start with CBD. And then quickly we realized that she needed some THC as well. So as Sibo, Osiris, and Miko have all said, being present required and demanded that we share the story that our families are going through. Because there's so many families that are in hiding. There's so many families that are struggling, and we had the capacity to say something. So I think I'm in good company here, certainly at the back of this train in terms of experience. But let's just maybe just have a conversation about different parts of our journey so that those listening, you know, might be strengthened to come out of the shadow or might be strengthened to even ask those questions, right? So, Sibo, I'm going to start with you, my friend.
Uh-oh.
So, in your intro, you spoke about being a medical cannabis refugee. Would you mind sharing a little bit about that move to Colorado? And I know a bit of the story, and I know for some it's going to be tough. But I think it would help. So, would you mind sharing a little bit about the move?
Sure. So I found out about cannabis in 2013, at the end of 2013, after watching the documentary Weed on CNN. And right there in December, I got together with some parents. We started an organization called Georgia's Hope, and we tried to pass a bill in Georgia. Now, Georgia legislator is only from January to about March or April. They only meet 40 days a year. So if you miss that 40-day window, you have to wait to the next year to pass a bill. We could not pass a bill by that 40-day window. So we were stuck until at least January 2015, where Jagger was getting worse. He was getting closer to his 4th birthday, which they told us was going to be his last one if he even make it to that 4th birthday. So long story short, we figured we have to do something, and I knew there were things in Colorado. I was talking to people in Colorado, so I left. I went to Colorado. I took some vacation from work, and I started just talking to anybody and everybody that would listen to me or talk to me: doctors, growers, dispensaries, parents. And I was there for about 5 or 6 days. And I knew when I got the plane back to Georgia, then we had to move to Colorado. But I knew I also had to sell it to my wife. So, but I'm in sales. So I figure if I can't even do that, then maybe I need a new job. As soon as I get home, it wasn't a problem at all. She was just like, yeah. And then we started the organizing. That was a lot of work because Jagger was and still is on hospice. So we had to transfer his hospice care. We have to transfer his doctors. We have to find an apartment in Denver. We had to, leave everything behind. And we say we're going to move for 3 months. We're going to give it 3 months. We're going to try, see what happens. Now, where it gets really difficult is that Jagger's not allowed to fly. Long story short, we had a plane a couple of years before that for going to a drug trial. We almost had to have an emergency landing because he couldn't keep his oxygen up on the plane. And long story short, we had to drive. And that was, to put it mildly, that was hell. It took us 6 days from Atlanta to Denver. We could not drive more than about 4 hours a day because Jagger would get so agitated in his car seat, he would start screaming, and then he would start breathing because he was so agitated, he would start breathing. And we only had so much oxygen with us because he was a concentrator on batteries. So every 3 to 4 hours, we stop in a hotel, we spend the night, we calm him down, we recharge the battery for the to Colorado the next day. So 6 days, but we made it. And once we get to Colorado, I had everything set up. So we had the apartment, we had meetings and appointment with the doctors. You need 2 doctors for minors in Colorado to sign for the red card. And so very quickly, we were able to get him the cannabis. And on August 20th, 2014, 2015, 2014, he got his first dose of CBD. And right away, we kind of start seeing some improvement, mostly, him looking at us and tracking around the room, things he stopped doing months before that. And then after a few days, he smiled. And I know this doesn't sound like a big deal, but that was the first time he smiled in like a year and a half. So that was a huge deal. And, I told that story. But right there, we look at, with my wife and Ed, we look at each other and we say, okay, even if nothing else happened right now, it was still worth it. The entire trip, the 6 days of hell, that was still worth it. But things happen, better things happen. After a few months, we added THC to his regimen, and we saw great result. His seizures went from 10 to 12 a day to 3 to 4 days. His pain, he was in horrible pain, and muscle pain because of his mitochondrial disease attacking his muscle. And he was on morphine and Oxycontin and horrible meds. When we got home on hospice, I was 1 year old. When they sent us home on hospice, he was on 14 medication and almost all of them opioids. But we started using the THC, and with that, we were able to diminish and wean and eventually stop the meds. And now, as of today, he has not touched morphine for a year and a half. He hasn't touched Oxy for like 4 years. So, cannabis has been great. And we were in Colorado for 13 months. And after 13 months, for many reasons, we had to go home. But one of them mostly was the breathing. The altitude was very hard on his body, and he never got used to the altitude. So the seizures were much better. The pain was much better, but the altitude and the breathing was not. Between that and the fact we were only supposed to be there for 3 months, and we were there for 13 months and have a house in Georgia and an apartment in Denver. Financially, it was getting extremely complicated. And then we also, my wife had to get back to work, and they were very lenient and flexible with us, but eventually we had to get back to work. And we passed a bill in Georgia. So we were hoping then that would help. Unfortunately, the bill was a possession-only bill. So that was in 2015, and today is 2020, and we still have a possession-only bill. So you can have cannabis oil in Georgia, but you don't have anywhere to buy it legally. So, but that's another story for another day. But that was being a medical refugee in Colorado. It was a great experience. I truly believe that saved Jagger's life, but it was very difficult, very complicated. And, we had to leave everything behind, our friends, support system, doctors, everybody we knew to go to Colorado. But I will do it again in a heartbeat.
Osiris, I'm listening to Sebastien, and I'm wondering, do you have some thoughts besides some of the reasons we heard from Sebastien? Do you have some thoughts of why parents might be hesitating to use cannabis with their families? I mean, he spoke about some hardships for sure. Yeah. Do you have any thoughts about why parents would hesitate?
Well, it's interesting because part of our podcast is trying to break into that area, trying to understand why parents are so hesitant. And a lot of it has to do with stigma, the uncertainty, I guess you could through the media of over the years that it's only negative. Only bad people use marijuana. People who just want to get high use marijuana, and that's always been the messaging, and it keeps going on and on and on. And eventually, when you find out that it's medicine, it's still the stigma still hangs over, the fear, the uncertainty. I mean, there was a time where I was speaking to my father-in-law, and we're alone, and he wanted to talk about CBD, and he's whispering. I said, "We're in the car by ourselves. You know that, right? There's nobody watching us. There's nothing to be afraid of. We could talk about this openly now." It's just the lack of education. I think a lot of it has to do with the lack of education and getting over the stigma, because that was something my family had to come to grips with, because here we have a 2.5-year-old, 3-year-old is using cannabis oil. And
sorry, go ahead.
So for us to have them, for them to watch him and then have to figure out, like, what is that you're giving him? Is he going to get high? Is he going to eat a lot? It was like all the negatives, like, no, stop. And even if that was the worst case, I'm okay with that than having him have 100 to 200 seizures a day.
Right.
Which was he was having. Literally 100 to 200 a day. He stopped talking. I had to teach him sign language. So parents don't understand is if you have to take that leap of faith, because like yourselves, the medication was the one thing we wanted to avoid. Compounding medication after medication. We didn't want to go that route. So that's why we chose to go with cannabis oil in conjunction with maybe 1 or 2 pharmaceutical drugs, and that's it. And now we're weaning him off the pharmaceutical drugs. So parents, I say over the side effects of what you get from pharmaceutical drugs than what you get from cannabis, worst case scenario, your child will be laughing. And you look forward to something like that.
100%. Nico, just to sort of segue from what could be, as he said, a hint for parents to get over, do you find that in your working with medical professionals that there's some hindrances, or have you found the other side where physicians and medical professionals have been very supportive, and that's been integral to either integral to how families proceed, or what have you found in that regard?
So I have a little bit of both. I am now working with medical professionals in several countries, and I see the transition. I see the change, and especially in more states that have adult use. The states that have adult use, the conversation that I'm having with medical directors is would you like for your patient to walk into a dispensary, or would you like for them to have the conversation with you? And so, or those constituents will leave and they will no longer be a patient of yours. And so I'm starting to really see a 360 within the healthcare space, which is awesome. I would like to tell Sibo and Osiris, I had no idea what Joey and I opened up. I'm very glad to see you both.
Thank you.
Joey passed away 2 years ago, and he probably has done more in 19 years than most people do in a lifetime.
In a lifetime, sister.
Yes, true.
And just seeing you both, knowing that we opened this door we only wanted to help one parent.
Yeah.
And that's it.
Well.
And so I know together collectively, we will be that guidance for families moving forward. Yeah. I don't have a choice. Right. So if you both ever call me, I will pick up.
Thank you. Thank you.
Thank you.
Thank you.
We are. When I began this broadcast, I said we are amongst trailblazers. That was the best word. But certainly there is a lot of heartache, and there is a lot of hard work that and plain old suffering that we go through, but that there's a lot of joy in accessing this medicine, because people like all of you, myself, the work that we're doing, we know at the end of the day, when we have these children with very life-limiting conditions, we know that it's just a little hinge that really we're swinging open a really wide door.
Yeah.
And thank you for all that you are doing for that.
Yeah.
Sebastian, you spoke a little bit about what's going on in Georgia now in terms of the laws. What are you finding to be the most challenging portion of advocating for Jagger to receive the cannabis? Just in the medical context, if you could just give us in that space.
Yeah, well, Georgia is a very red state. I know some people say it's purple, but let me tell you, when you're in the trenches, when you're in the Capitol, every week it's red. It's, the Republican almost have a supermajority there, so they can do whatever they want. So we had to work with Republicans, which are usually not the people that push for cannabis law. But we found out, we found some really good Republican legislators that were willing to listen to the stories. And many of them, once, it was not just me, it was hundreds of parents in Georgia. But once we shared the stories, we found out that most of them were willing to help. But there's always a but. For a lot of them, the growing and the cultivation and the distributing in Georgia was that line in the sand. They were not willing to do that. They were willing to let us get it from another state, which is illegal, but that's besides the point for them. But they were really worried about growing. And I think the main issue in Georgia is because they worry about recreational.
I see.
And actually to the point where in the bills, in almost every single bill we pass, because almost every year we pass a bill, first it was cultivation, it was a possession, then he was adding some conditions, then he was adding some more conditions. And then finally, in 2019, we passed cultivation and distribution, but that was April of 2019. Now it's September of 2020, and we still don't have anything. The good news is, on Saturday morning, they're supposed to announce that the application for the licenses will be out. So they're saying about a year from now, we should have products on the shelf in Georgia, but that's still another year for people to suffer, not get medicine or break laws to get their medicine. But recreational has always been the big worry. The Baptist group have been so much against us, spending a lot of their lobbying money to fight us. We try to play on them and, to explain to them that this is a compassion issue. Let's be a Christian. You're a Baptist. You should understand that. But no, that was a red line for them. No cultivation in Georgia. And so that was the main issue. And in every single bill we pass, it has always been the line of we do not support recreational cannabis. So they want to make it very clear. Almost every politician that took the well on the floor of the assembly floor and spoke say this is not recreational. We do not support recreational. And I think this has kind of been hurting us to a point, because that's been slowing things down, because everybody still to this day, all the politicians are still worried that once you open the door on medical, recreational is coming, and they don't want to do that. And what we explain to them is that recreational is a different fight. I personally have no problem with recreational, but that's not my fight. My fight is medical, to get what my son needs and what the other kids in Georgia need in Georgia. Then I can go to a dispensary down the street and buy what I need. Then I don't need to break 50 laws to go to Colorado every few months, risk my freedom to keep my kid alive. Your access should never depend on your zip code. That is a total injustice. Access should never depend on your zip code. And in Georgia, it's what it is. Access depends on a zip code, and that's absolutely wrong. And hopefully, like I say, in the next year or so, we'll be able to fix this issue. But it's been a long, I've been doing this much less long than a lot of people on this panel, but it's been a long 6 years to pretty much so far still having to break the law to keep my kid alive.
So Osiris, speaking of a long 6 years and even more for Miko and less for me, can you shared the story about your father-in-law being in the car with you whispering about CBD, but are are there some other experiences that you know that parents are facing with family members as they try to access the medicine? Are there is this a division? Is this a line in the sand for families? Or what are you seeing? Because I know on your podcast you've spoken about this before, but what have you found?
I found that there's a small number when it comes to the fine line, because especially
Okay.
the old school people who are from the back in the days, like, oh, we don't do that stuff. Only the people who are bad on the streets, hoodlums, and things like that.
Okay.
But then now you're starting to now that it's starting to pick up momentum and it's starting to be around you more and more. So they're starting to come around. So yeah, I started having this back pain, shoulder. So what's the CB thing like can you get me a little sample or something? Hey, maybe an edible. It starts out like that, something small. Usually they'll start with the topicals first. Let me go slow. Let me try a topical. Right. Then they'll upgrade to let me try an edible.
Right.
Yeah. And then they're calling you and say, hey, do you have any more? So especially when they have trouble sleeping. So this usually that's the first place they want to go to. It's like either the topical or the sleeping. I'm having trouble sleeping. You have any advice? Try the CBD.
Right. I think just to piggyback off of that, Osiris, I know of a family where the grandchild was the first patient in the family and had such good results with the grandchild that the grandmother went to the mother of the child and saying, hey, I have this pain in my hip and I don't want to take anything. Do you have something for it? Now, the grandchild was maybe like a seizure patient or something like that. So you go from seizure to hip. I mean, there's no connection except that, the mama in the middle, but I think you're right that sometimes families are seeing other members, or as you said, watching on TV or listening to radio, especially on the East Coast. You New Yorkers, you love your talk radio, right? Oh, yeah. So they hear talking about these subjects of medical cannabis, CBD, CBG, CBX, all these CBs, right? Yeah. And that really has been I think a segue when someone else in the family begins to use it. So good to hear that as you were talking with people that in fact you're finding that true. Miko, do you? So in my state we have a caregiver license. So I am my daughter's caregiver. I am licensed to give her THC containing meds. There's I have to go through the regulatory process just like she did to become a registered patient. Do you know if every state or most states are requiring a caregiver's license, or what?
Every state should.
Yes.
But I'm noticing in the states that have an adult use act, or adult use, it's really a lack of guidance. Okay. So typically on an average day here in California or elsewhere, I get a call from legal counsel, social services, to intervene in CPS cases. Now, what has happened that no one has yet to address is state laws have not caught up to federal laws. And that little in between is one of the reasons why I'm on call 24 hours a day. I am asked to help vet out families, help write letters, and to get cases closed in 72 hours, because as these states are adding autism as a list of criteria, they lack the guidance. And what happens is, and what I'm seeing is this is a privilege. This particular treat option depends on your class. It depends on your neighborhood. It depends on who you know. I've been inside courtrooms where family members have been the ones to contact Child Protective Services. I've seen families, just completely torn apart. And, I know, we are a part of a very small percentage of families across the country who actually could be able to utilize this treatment option. But if we continue to not provide guidance, there's going to be a further more families that are falling through the cracks.
Mm-hmm.
I'm only one person.
Mm-hmm.
I've been a legal secretary for over 20 years. And so when my son ended up being my biggest case, I realized now I need to put this in place for families just like me.
Mm-hmm.
And so I do, I'm literally on call, whether it's a parent, a court, and it's usually a court not even in my state.
Mm-hmm.
So I'm hoping with SIBO and Osiris, we can do something together. So at least if we are going to add autism as a criteria moving forward, we need to hold education also a part of that.
Mm-hmm.
Here we call it the Joey's guidance, because once they contact me, I'm a one-stop shop. The navigation, finding a product is the easiest thing to do. Navigating until further federal laws are passed is what I deal with on a daily basis. And so I believe the four of us will be able to put something together to ensure that parents know that they need to get a caregiver's license, because the adult use is that bill is running through states and is getting passed, but they're forgetting about us.
Yep.
And in Arizona, I believe parents and nursing groups have tried, I think twice, to have autism added to our list of qualifying conditions. And if I may interject here, the concept of having a list of qualifying conditions is so frustrating, right? Because we are at this catch-22 where on the one part of the circle you say, well, there's no medical relevance, and then on the other part of the circle, because there's no medical relevance, we can't do research. Well, if we can't do research, then we can't say, if all of the states have the justification that unless it is medically proven efficacious, then we cannot have it as one of our qualifying conditions. And so we're in this horrible sort of circuitous, situation that it's profoundly difficult for families that are trying to navigate. Right. And it's more of a hindrance it's like a boulder in the road of where we're trying to get to. So your answer is we definitely need a caregiver situation. Do you happen to have any idea as to how many of the states do have the caregiver requirement? Are there more, so of the states that have it, are more states requiring a caregiver situation than not, or 50-50, or where are we?
I believe they all require a caregiver, the states that have the medical. Here in California and Colorado, it gets pretty tricky. But again, as a whole, any state, and that's why I think the four of us will be able to be extremely successful in doing this. Every state that is allowing for children, anyone under the age of 18, to have a caregiver's license, they need to couple that with education. Most of the parents who contact me, I am walking them and taking, them through the entire process. Resources are only as good as as much as the advocate knows. And so what I am seeing is a lack of advocates that look like us and know the dynamics in our homes.
Yeah.
If again, that has been one of my, even when I started, that is what was one of the biggest problems that I was coming across, was advocates who had no idea how many agencies were in my home that were federally funded. And if I disclose that information, and I've actually seen and been through quite a few family law cases in which families lost services because no one was advising them or providing them with navigation that actually applied to what goes on inside of our homes. And so every consult that I have, it's a confidential consult. If you're going to an advocate and that advocate is very free to give information without a million disclaimers, that's the wrong advocate.
Got it.
You know, we really need to pay attention to following the special education composite of laws. They apply to this particular treatment option as well. And so I think, you know, putting together just an educational requirement when you get a caregiver's license will help, and hopefully I'll be able to take a vacation because, you know, I feel like I'm an urban myth, and there are
true
within family law court. Contact Miko Perez, and I only sit on one board, and that's the Normal Women's Alliance, that allows for me to be recognized to be able to close cases. So if that's something that would help the caseloads from these social workers, and also just support families the way that we should be supporting them. Because right now, adding them on to a bill, and I understand how important that is, but there's still that catch-22 that we have to deal with. And we're already going through a lot of heartache getting to, and harassment and stress getting to cannabis. And then you get a knock at your door. That's not what we open the door for. So I think the best way to handle this is if we start supporting these families by putting together a bill for them that actually empowers them.
Absolutely.
Absolutely, absolutely. So we have a few more minutes before our time is up. So I'm going to just make mention to those that are watching. If you have any questions, please, just send them through so that we can maybe direct or be interactive or be of more help, be of more service. Really, at the end of the day, that's why we even open our mouths to be of service, right? Because as I said, we are targets. We start for our own children. So please, if you think, throw it up and we'll try as we can to share. With that, I'm going to keep going on. I wanted to ask Osiris if I could get a little personal, because I know that you have to run from us, and maybe we all have to run. But if I can get a little personal, now I feel like we're close now.
I guess you haven't listened to our podcast. We leave it open. We put it
wide open. Right, put it out there, wide open. That is true. That is true. I think in the cannabis community, I can say that families that are two-member families that are parenting special needs children, there are a few.
Yeah.
So I know you and I know Sebastien. So those are my two. We're covered. I know two families.
You know three.
Okay, sorry. Miko, I'm sorry. Now
I remember you said that, so.
Yeah, my numbers are tripled now. My numbers are tripled. So starting with you, Osiris, what have you found, or how have you found your relationship, your marriage to be affected because of your decision to use medical cannabis with your child? And I'm going to ask that same question of all three of you.
You want the short or long version? Let's just put it this way. We almost ended the relationship twice.
Okay.
And that was real. So, I mean, we fought prior to even having a child because we we come from different backgrounds and different ideologies and how to raise a child before we even had a child. So we fought over that.
Mhm.
But then when the child got here, we were like, okay, we can work this out. We have differences when it comes to the medical institution because my wife's worked in hospitals. She has a physical therapy background. I don't. So I do in-depth research and I'm very skeptical about a lot of things. So I'm pretty much, I guess the idea of vaccinating a child before 3 years old. So we had that going against us.
Oh yeah.
So a year prior to my son getting on cannabis to treat his ailment, I was already getting educated for it. So my wife knew nothing about it, never been exposed, didn't know anything about it. So I was really trying to get her caught up and trying to understand the cannabis industry in general and you know what it's used for and how it's medicine. Not knowing that a year later we would be coming together to decide, are we going to go through with this?
Wow.
Surprisingly, that the fact that I was able to, you know, educate her on it, provide her information, because my wife's like, show me the research. Show me the research. That's all she's ever done. Show me. So once I started providing actual research and information, she was like, okay, sounds interesting. Speed up. Year later, my son is diagnosed with epilepsy. The decision to do it wasn't as hard.
Ah, okay. Okay.
Because she was already prepped. But not to say that throughout the course of the relationship, it was not easy because of all the stress that came about it. What we found out during our podcast, doing some research, that out of the 50% of marriages that end up divorce, 90% of them are due to a child that's disabled in the home.
Yes. I'm living that statistic.
That's obscene. It is from
Yes.
the stress. And we saw the stress.
Stress.
That we were going through.
100% the stress.
Because you're trying to figure out, well, do I stay home or do you stay home? Who's going to decide to give up their career in order to stay? Because it's a full-time job.
At least 2 jobs.
At least. And, you know, your bosses don't care for the most part. They'll care for a little bit. They want to show that they're kind. Then after a while, it's like, look, I pay you to be here. For your body to be here. It's not your child. So it was really challenging to try to do that. And in fact, I had to quit a couple of jobs because I made the decision to stay home. I had a bit more of a flexibility than my wife, but she's already invested in a city agency.
Sure.
So you don't want to give up the pension. So that's how we made that decision.
Okay. Okay. Sebastian, I'm going to ask you the same question. Stress on the relationship, impact, effect. Would you share?
Yeah, no, absolutely. Yeah, I mean, it's very, like Osiris say, the divorce rate in special needs families, it's insane. And I know the people I'm advocating are actually single family home because there's only one parent. Usually the mom, usually the dad is the one that take off. Now, I could never imagine leaving my special need kid or any kid for a matter of fact, but sadly, a lot of dads do. And when you have those situations. Now, the other thing that happened is when you become a medical refugee, very often only the mom and the child were able to go to Colorado. And in Georgia, we had 13 families, and of the 13, I think like 11 had to be separated. No, it was temporary, but they had to be separated just to go to Colorado, and that put a huge strain on the marriage. Now, we were lucky enough, and both my wife and I were able to go, and we're very lucky in everything that's happening. Then we are both have very flexible jobs where, my office is in Chicago, I live in Atlanta, I'm in sales, so I got to travel a lot. So that puts some strain on the relationship too, but at least I don't have to be in an office every day. I work from home, been working from home even before my son was born. So that helped. And then my wife only has to go to the office a couple of times a week before COVID. So that also helped because she could be home. Because we try having nurses for Jagger. It never worked out. He doesn't do well with strangers. And then it's very, very difficult, at least in Georgia, and I'm sure it's like this around the country, but to find a good home nurse, it's nearly impossible. First of all, there's no budget. And then even when you pay for it, there's always issue, and they're there for like 2 weeks and then they leave, and then you have to train a new one. And finally, we made a decision after 5 or 6 nurses. We say, we're just going to do this on our own. Now, we're paying for it by not sleeping, 3 to 4 hours a night is all we get. And it's tough, but we get used to it. Now, as far as using the cannabis, I've been the one that was doing the research. I'm the one that was interested in it. Now, my wife is a scientist of the family. I'm in sales. She's actually an epidemiologist. So she's a scientist of the family. But also because she worked for the government, she couldn't really get involved with it very much. So she said, you take the lead, you look at it, you tell me, I'll look at it, I'll agree or disagree, but I'm not going to put my name out there. It's not going to be my face because of my job. And so that's why, it's a team, but every conferences, everything that happens, it's always me and my name there, just because we got to protect her and her job, working for the government. But she's always been very supportive. She's always wanted to learn about it. Right now, I'm pretty sure she's in the back giving him his cannabis because my phone just had a little alarm when his dose was due. So I guarantee she's in the back giving it to him. So I'm very lucky, and we are a good team, and we've been able to work this out, and we're very much on the same page when it comes down to that. And some of it might have to be because where we're from. She's from Germany, I'm from France, so we grew up in the European point of view, which is very different. And my dad was a doctor. Oh, he is still a doctor. My mom was a nurse, so I kind of grew up in the medical field, lack of better term, because I remember my mom working night nurses and my dad keeping me at night and my mom keeping me during the day when my dad was going to med school. That's kind of the first memory I so the transition wasn't so hard, but yeah, I think we are one of the lucky one to have still a full family, very supportive, and to not have separation and heartache and things like this. But it's tough. Like I say, a lot of the family I know in this cannabis world, they are single parents family because special need, and that really don't have so much to do with cannabis. It mostly have to do with being special need. It's so much stress on a marriage and a relationship. So, and I honestly don't know how we fix that. I don't even know if we could, but I wish there were maybe an organization or somebody that would try to maybe offering free counseling or offering help. That might be a different topic for a different day, but it's a big problem, and it's also bad for the kids to just have one parent. It's usually better for a kid to grow in a two parents household. So I don't know how we fix it, but hopefully maybe someday somehow we can.
Well, when Miko's finished with,
just to let you know, we started using cannabis just to save our marriage.
That's awesome. That's awesome.
So I have an idea. When Miko's finished solving the legislative thing about cannabis, we'll give it back to her. She can solve the whole special needs family divorce rate thing when she's finished with this cannabis thing. Miko.
Because actually I got married. So
there you go. There's the solution.
Yeah, here's the solution. So, I had to choose between law school and taking care of my children.
Wow.
And at the time I was a single mom, and I opened up an attorney service so I could attend both of my children's appointments and you name it. And what happened is I started working back home in Puerto Rico 10 years ago. And as I sit on the Society of the Puerto Rican Cannabis Science and Medicine, and I started working with the College of Physicians, and I out of the blue, I met my husband.
Oh, and the moral of the story is I need to go to Puerto Rico and sit on a board.
To help, right.
And then that's going to change everything. Okay, I got it.
It changed everything because I was doing what I was supposed to be doing. And that is going back to give back to the autism community on the island. And I never looked at being a single mom as a crutch.
Right.
By default, there's nothing you can throw at us that we can't catch. We are we're super parents. And so I knew as long as I had a million agencies coming into my home, I was never getting married ever. I did. And so it wasn't even a thought. So as soon as I got comfortable, and as soon as I said, well, you know what, I'm just going to walk in the path that was given to me.
Okay.
And I met my husband, who works in the pharmaceutical industry. He has become my right hand. He writes all of my scientific descriptions for everything. Sometimes I commend all of the families who walk into my office that are together, and I give them a speech like no other, because I am so glad to see them coming. And when I see single parents walk in, and I'm seeing a lot more single dads walk into my office, and I also give them the same speech.
Wow.
Whoever that you're supposed to be with, you will know.
Mm-hmm.
And sometimes that isn't the spouse that you started with. So it really is just empowering whether you're together or not. But I don't think that my story is isolated.
Okay.
The right person to complete the family unit was definitely the right person that I should be with. And so I don't even subscribe to this. When I hear, and I hear it a lot when parents say, well, you know, I can't do this because I have a million. Well, there's another person out there that's going to be able to support you. You just have to be patient. We are so patient with our children, and that person will appear.
Mm-hmm.
And I can speak to that because one day I woke up and I said, oh my God, your family is my family. And I did not know because I was so involved with doing what was right.
Mm-hmm.
And that was giving back to the island, giving back to families. I mean, when I step off the plane, I'm walking into neighborhoods. And that give you know, that pay it forward and giving back actually opened the door to the person that I'm with now. And autism again has given me everything that I've ever wanted.
Mm-hmm. Mm-hmm.
So it's definitely a story that I don't share with many folks. When it was, don't come into my office and say you're not going to find someone. They're probably right in front of your face and you don't see them, because that's exactly what happened to me.
Yeah. And again, as we said at the beginning of the broadcast, there's a lot of joy. I know that all of us are sipping on some of the most nastiest of lemonade possible. We got some nasty lemons. We try to make it lemonade, but there is some joy between those sips, and unification, growth of families, growth of self. I mean, look at all the work, look at all that has come behind us because of the work that we're doing. That little hinge of just opening our mouth, well, it swung open big doors. I mean, on federal levels, and Sibyl, we didn't get a chance to touch on it, but you have a federal case in which, you're trying to swing open this really big door, and Osiris, you about, open that door, and Miko, you're talking about swinging open that big door around the world. So certainly in this journey, although there's a lot of nasty lemonade, we are finding some joy, and we are at the bottom of the hour. And I want to thank, with the deepest of heart, each one of you for being here and for sharing. And perhaps we can have this conversation. We can continue the conversation. There's some things that we didn't get to touch on, and some things that I'd love to circle back around. So perhaps we can figure out how to to have another conversation. But I thank you all for coming. I thank you all for showing up here. I thank you all for showing up in your locales and doing the work and leading us to where we need to be. So thank you so much for everything. And with that, I think we're going to end for today. If everyone wants to maybe say, something 30 seconds as we're on our way out the door, that would be lovely. Osiris, go ahead. And Miko, Miko, do you have to go?
This is all.
Yeah, I have to
keep fighting. That's all I can say. Just keep fighting. One family at a time. That's all we need. One family at a time.
Okay, awesome. Thank you.
And I would like to say thank you as well. And I look forward to keeping in touch with you all three of you. Yeah. I have a blog, mikosblog.com. Okay. You can find me on any of my social media under Miko Perez. Okay. I am forever grateful to have met all three of you today.
Thank you so much,
Thank you for what
Miko.
you've done. Thank you.
Sebastian, do you want to say goodbye for your 10 seconds?
Yeah, thank you very much, everybody, for watching. And just please remember that you're not alone. And
Yes.
there are people around to
Yeah.
help you, like anybody on this panel and other people in your community. So if you need help, if you have questions, please reach out, because don't just Google things and believe everything you see on the internet. Ask the people that have been there and done it before. So please reach out.
Sebastian, one quick thing. Do you have your, can you share with us your website? And then Osiris, would you share with us again your podcast? And then we'll close it out.
Okay.
Yeah, the website, where we have mostly on a Facebook, and we
Okay.
have a Facebook page for Jagger. It's moves like Jagger 14 on Facebook, and then we have Georgia's Hope Facebook page, which is more about Georgia and what we're doing here to get access to patients.
Thank you so much, Osiris.
Yes,
Thank you.
we're on and anywhere you could actually download your podcast that you listen to, and it's
Okay.
called Love and Cannabis.
Thank you so much, gentlemen. Good day
No
to
problem.
you.
Thank you, Michelle.
Thank
Appreciate it.
you.
Bye-bye now.
Bye. Thank you.